Hi, everyone, and welcome to the SRHM podcast, which explores new research and emerging trends in the field of sexual and reproductive health and rights, with a focus on using rights-based knowledge for action. My name is Nina Sun, and I am an associate editor for the SRHM Journal.
Hello and welcome everyone to another compelling Friday episode of the Sexual and Reproductive Health Matters podcast. Today we have the privilege of hosting a crucial discussion with the authors of a thought-provoking new commentary published in the SRHM Journal, Lessons from Kenya on Sexual and Reproductive Health and Rights Policy Making, the Need to Center Voices from Africa in Global Discourses. My name is Jessica McKinnon, and I am the Communications Manager at SRHM, joining you from Cape Town. Joining us today are three powerhouse leaders in the SRHR space. Evelyn Opondo, Africa Regional Director at the International Center for Research on Women. Jade, Maina, Executive Director of the Trust for Indigenous Culture and Health. And Nelly, Munyasia, Executive Director of the Reproductive Health Network, Kenya, all joining us from Nairobi. Thank you for being here today to share your insights. At a time when executive orders in the US are sending shockwaves across Africa and beyond, threatening hard-won gains in sexual and reproductive rights, this discussion couldn't be more urgent. Your paper not only highlights key lessons from Kenya's SRHR field, but also offers concrete strategies for resisting the growing anti-rights movement. So let's dive in. Before I turn to you for questions about your paper, I would love to read the introduction from the commentary, which is very powerful and sets the scene for our discussion. In a world where the global anti-rights movement is gaining alarming influence, the relentless assault on the rights of women and girls, gender equality, and the LGBTIQ+ community has reached a critical juncture. Anti-rights actors have used and continue to use underhand tactics and backdoor advocacy to access and dominate policy and decision-making spaces, significantly impacting the policy landscape and provision of comprehensive sexual and reproductive health information and services. Such tactics create an environment that emboldens policymakers to go against rights established in national laws, global and regional human rights instruments, and existing evidence. The tactics range from pressure from foreign governments with threats of defunding development initiatives and interference of religious groups in formulations of policies to infiltration of policy-making bodies. As these tactics are playing out in Kenya and in several countries across Africa and the attacks escalate, it is imperative that we stand united to defend the fundamental principles of human rights, social justice, and equality for all. So Evelyn, I'd like to start with you. Why was it so important to publish this commentary at this particular moment? What prompted you and your co-authors to bring this perspective forward now?
Thank you, Jessica, and it's a pleasure to be here. Our article addresses several important rationales. It looks at the underrepresentation of African voices by highlighting the lack of adequate representation of our perspectives in global discourses on sexual reproductive health and rights. It argues for the inclusion of voices from Africa to ensure that policies are relevant and are effective for our continent. It also looks at the impact of anti-rights movements by discussing how the anti-rights movements have influenced policymaking in Kenya, often leading to policies that undermine sexual reproductive health and rights. This is a critical issue as it reflects the implementation of comprehensive sexual reproductive health services. We also look at policy implementation challenges by examining the challenges that are faced in implementing sexual reproductive health and rights policies in Kenya, including the interference from foreign governments, religious groups, and other anti-rights actors. It stresses the need for evidence-based policies by emphasizing the importance of basing sexual reproductive health and rights policies on solid evidence, and importantly, on the local context to address the very unique challenges that are faced by the different regions in Africa. And finally, our article underscores the need to defend fundamental human rights principles and social justice in the face of increasing attacks on SRHR.
Thank you so much, Evelyn, for those insights. I would love to hear from each of you, while writing this paper, what personally stood out to you the most? Were there any findings or reflections that particularly resonated with you?
One specific finding that stood out to me is the global coordination of anti-rights movements and how efforts to undermine sexual reproductive health rights in one country can have ripple effects worldwide. And we have continued to see that even after our article. Our article illuminates how anti-rights groups in Kenya are not operating in isolation, but are part of a larger interconnected network influencing policies across borders. For us, it highlights the critical need for flexibility and adaptability in responding to this ever-changing context without losing sight of the overarching goal, which is to advance sexual reproductive health and rights. Additionally, what also stood out for me was the need for us as Africans to be at the forefront of shaping our own destiny, and just underscoring the importance of centering African voices, not only within Africa, but within the global discourse, to ensure that the policies are contextually relevant to us in our countries and in the region, and that they effectively address the unique challenges that are faced by us in the continent. Thank you.
Yes, go ahead, Nelly.
Just picking from there, my name is Nelly Munyasia, the Executive Director, Reproductive Health Network Kenya. So for me, one thing was how foreign governments have so much power to the global south and how they are able to determine the reproductive rights landscape. And we see this when we have a whole pronunciation that is made in the US, for example, and have a whole ripple effect to policy making, to implementation of some of the existing policies, and also to the provision of services, which includes safe abortion services, and also to how the LGBTQI rights are violated back in the global south. Another thing was how, again, the foreign and the anti-rights have so much influence when we look at Kenya, for example, in 2013, where we had the guidelines that were supporting the reduction of maternal morbidities and mortalities due to unsafe abortion being withdrawn. And we see that replicated in Uganda. We see that replicated also in Lagos. So really the much influence that the anti-rights groups have over us, especially in the global south, is really something that really we need to be standing up against right now and just saying no to it. And also where these, Evelyn had correctly put it, well-coordinated movement that then targets our members of parliament, the legislatures, targets our legislatures, and also targets essentially the policy makers. And you see a situation where an act is initiated in Uganda, for example, and the same act, copy and paste, is also initiated in Kenya by the same legislatures that have been trained by the anti-rights groups. So really, those were some of the things that really stuck out for me.
Thank you, Nelly. Jade?
Yeah, thank you so much. And I can take it from there. And just to say that for me, what stood out in this report was the significant influence that abortion anti-rights and anti-right groups such as International Family Watch International shape African policies. We see, for example, an example in the report where progressive reproductive health guidelines, such as the 2012 standards and guidelines in Kenya, for reducing maternal mortality due to unsafe abortion that were adopted in line with the Kenyan Constitution were withdrawn under the pressure of these international anti-rights groups. This demonstrates how easily policies can be undermined despite them being protected in the Constitution. We also saw that Roe v. Wade ripple effects across the globe. In our own country, we felt this being bolstering anti-abortion rhetoric, especially even in judicial processes in Kenya, this being mentioned in precedences and in legal argument, which reveals just how interconnected global and local reproductive health right frameworks are. So this definitely makes us worried about when there's regression in one part of the world and how anti-rights groups use that conversation to therefore push for more regression in other parts of the world.
Thank you so much, everyone, for sharing your thoughts. Now, at SRHM, we are committed to turning knowledge into action. And given this well-coordinated anti-rights movement that has this influence, looking ahead, Nelly, I'll turn to you. Where do we go from here? Now that we have this evidence, what do you believe should be the next steps?
As we think about where do we go and just looking at how, number one is we need a more coordinated intersectoral movement that is also allowing other actors, such as the healthcare providers, having people from academia, people from research, and also policy makers just coming together collectively to ensure that we are continuously generating evidence, because we cannot afford to be emotional about it, but we need to generate evidence, facts that are Afrocentric, and ensure that we are using this to advocate and ensure that we are not losing on the progress that we've made over the years. We cannot afford to ignore working with government. More than ever, we need to be on the decision-making tables. As actors in the space, we need to work very closely with our governments to ensure that we are also influencing policy. We are at the table where the anti-rights groups are sitting, and also just identifying critical experts who include, of course, legal experts, healthcare providers, activists that have been there and understand the landscape to be part of decision making and also development of policies that support us in not losing out on the gains that we've made over the year. This is the time that the abortion movement, LGBTQI movement, women rights movement need to work together. We cannot afford to silo abortion and LGBTQI rights, because we have seen when the anti-rights groups hit, they hit us all collectively together. So we need to work together, develop strategies that address issues around abortion, LGBTQI collectively, and also have voices that then come out to support the rights as a whole. Then we also need to be very intentional in generating evidence, and also continuous capacity building of healthcare providers, because when we think about access to safe abortion services, then healthcare providers are very critical. They play a very crucial role, not only in terms of service provision, but also engaging government as experts because of the services that they provide, and also including even providing services to LGBTQI community. So really ensuring that they are well capacity built, they have the information, they have the knowledge to be able to engage when they are needed.
Thank you so much, Nelly. Finally, I will turn to you, Jade. This is such a crucial moment globally. How does this evidence connect to the larger political landscape and current global events?
Well, we are standing at very interesting political times, as we have seen. Very recently in the United States, President Trump's administration has started its term. And with that, as with previous Republican presidents in the US, he has reinstated the global gag rule. Each time round, Trump reinstates it. He tries to make it more extensive. And what we have seen is even before he won this presidency, there were anti-rights groups that got together and developed something called Project 2025 that looked at not just abortion rights, but human rights more broadly and aiming to target more human rights, including LGBTI rights, marginalized group rights, etc. And every time we have seen the global gag reinstated, the same thing happens. We go into fear mode, anti-rights groups are emboldened, funding moves from rights group organizations because then they are not able to sign on to US government funding and is then channeled into anti-rights groups, which then become more funded and more coordinated. What this then results to is that it creates significant barriers for health organizations in reproductive health, being unable to do advocacy work, being unable to provide access to services, even when these services like abortion services are permitted under their law. This just goes to show how the US foreign aid policies directly curtail access to comprehensive reproductive health services in developing nations like Kenya. This particular time, we have seen Trump's administration go even further to issue stop the work directives. And these directives have gone to affect all US government funding. It has deeply affected HIV care, including distribution of life-saving ARVs. It has affected human resources with people being laid off or being asked not to work. And therefore, many years of building health systems that have relied on this kind of funding is being disintegrated as we speak. These stop the work orders, even if they will be lifted at some point, the damage that is being caused right now, most of it will not be reversible. As we know, when people who are on ARVs are consistent with their medication, it leads to disease suppression and therefore inability to transmit the disease. Some of this is being reversed right now because people are unable to be on their medication. They are unable to, even if they were to get onto medication again, they might need to go to another level of second or third level of medication, which sometimes leads to drug resistance. So these policies are clearly problematic, and we can see they're targeting to infringe on rights of LGBTI individuals and women and people who are pregnant to access abortion, but in the way they're being implemented, they're affecting all human rights and all people's health across the globe. Essentially, I feel that this continues to be a concern for all of us because this also strengthens regressive movements across the world, especially in developing nations like Kenya. It results in reduced access to vital health services. It further stigmatizes sexual and reproductive health issues. We have seen anti-rights groups in the country be very excited about these changes. One such example is the sponsor of the anti-homosexuality bill in Kenya, Peter Kaluma. Upon this announcement, has promised to dust his bill off the shelves of Parliament and table it again in Parliament. Seeing how things are going, we are deeply concerned that this bill will possibly come to Parliament, possibly get passed, and therefore curtail the rights of individuals who are in the LGBTI community.
Thank you so much. Thank you, all of you, for joining us for this vital conversation. This discussion really highlights just how crucial it is to center voices from Africa in global discourses in the fight for sexual and reproductive health and rights. For more details, please be sure to check the show notes where you'll find a link to the full commentary, as well as information on how to publish with the SRHM journal. If you'd like to contribute to this discussion, whether through a commentary, research article, blog, or other format, we'd love to hear from you. As the authors have so powerfully emphasized in their paper, now more than ever, we must stand united to defend human rights, social justice, and equality for all. Let's keep the conversation going and the movement growing. Thank you so much, Jade, Nelly, and Evelyn. Until next time, take care.
Thanks for joining us for this insightful conversation. Please check the show notes for a link to the SRHM Journal, which is available online and open access. Follow us on social media and sign up for our newsletter to receive notifications for new publications. If you're enjoying this podcast, please subscribe, give us a rating, or leave a review. Sharing evidence-based and rights-grounded knowledge is our passion, and it's also critical to support the advocacy and actions that need to be taken to improve SRHR for all. We would very much appreciate it. Thank you for supporting the SRHM podcast, which is produced by our staff. The music was composed by Tiber Christian and Salomon Beautombe.